How are you? Welcome to Critical Moves of Telesur. The maximum organism in sanitary issues have now had a review on the actions to contain the infection of COVID-19. From the standpoint of the geopolitical and based on everything that was debated here, this is what we're going to review today. Let's begin. One of the maximum authorities led the 73 meeting of United Nations, and during the 18 and 19 of May, they held a session. These are some of the things that were said. The pandemic has brought out the best and the worst of humanity, strength and fear, relation and discrimination. It has revealed the disequalities, injustice, contradiction of our modern world. It has revealed our strength and our vulnerability. More than ever, the pandemic shows why the investment in health should be at the center of the development. Now more than ever, we need a healthier world. Now more than ever, we need a safer world. Now more than ever, we need a more fair world. Now more than ever, we need a World Health Organization. We will continue to contribute with investigation and to develop the vaccine. We will continue to work with all of the allies to ensure the success. Why don't we do a map of this organism and why was it created? What is it about? Let's review this. WHO, new aggression focus. The World Health Organization is the authority of the sanitary action within the United Nations system. This organism has many functions, among those to lead the sanitary affairs in the world, make the agenda and investigations on health, and establish sanitary norms, articulate the options of politics based on evidence, to give support on technical support to many countries, and to be vigilant of the sanitary situation. It was born within the Economic and Social Council of the United Nations in 1948, and it was until 1948, until the first meeting in Geneva, Switzerland, when it was held. 196 countries are part of it, and they have a say through the World Assembly. This is a multilateral organism, and they send in a delegate each country to the summit, and they also approve the budget. In this meeting, 34 members are technical members are part of this, so they will be the executive council. That what they do is to put forth the policies of the assembly, to suggest work and to guide the work. The objectives are to promote the development of the people, foment sanitary security, foment health systems, take advantage of investigations, bring forward the alliance with other organisms, and improve their own development. It's very important to see how this virtual meeting was held in this 73 session. What was approved? Let's see. In the midst of the COVID-19 pandemic, the 73 meeting of the World Health Organization was held. For the first time, it was held through a virtual mode. The central subject was the pandemic of the coronavirus that has left more than 300 people dead. The European Union, along with countries like Mexico, Australia, India, Russia, Brazil, presented a resolution that demands an independent and transparent evaluation about the World Health Organization in the handling of this pandemic. This was approved by the Directory and approved by unanimity. What they're trying to do is to make a profound examination and see how they have the capacity of response to a pandemic such as this. The resolution also asks for the universal access to the distribution of all the technologies and sanitary essential material. This proposal, along with 140 countries, has 150 budgets, among which the declaration of solidarity with all of the people who have been affected, and to recognize the responsibility of the governments in taking care of their people, along with seeing how necessary it is to immunize all of the people on a worldwide scale. However, this meeting had expressions against by the United States. According to Alex Azar, Secretary of Sanitation of the United States, one of the main reasons why this pandemic came out of control was because the World Health Organization did not provide enough information. Same accusation was made against China, that they were apparently trying to hide the pandemic. In this context, Xi Jinping, President of China, defended the transparency of his management of the COVID. He said that he has always shown responsibility and transparency. It's important to say that while the White House tenant said that he was going to suspend the economic support to the World Health Organization, China has a different position. On their behalf, they had offered $200 billion to the most vulnerable countries. Let's begin our revision of digital websites, basically basing on what we just heard. This is from Shenhua on May 20th that says, experts criticize the letter of Trump to the World Health Organization. Several experts have criticized the letter of Donald Trump to the director of the World Health Organization. The professor of the O'Neill director, Lawrence Gustin, from the Georgetown University, said that this letter is like a product of a threat. And of course, this is wrong. Gustin, who is also director of an OMS branch, questioned the capacity of Trump to carry out these threats because he says that the Congress will not support to abandon this organization. Max Boot, who is the lead investigator of security of the Council of Foreign Relationships, also said that it's hard to believe a document that could be less convincing and less counterproductive in a letter published by the Washington Post in response to the letter of Donald Trump. To threat to leave the WHO during a pandemic is just like saying to get a shoot to Clorox as an answer to the pandemic. The United States had an alternative, and they were slow to respond. That is Trump's fault, not of the World Health Organization. The Lancet, an important British magazine, said that Trump was wrong when he spoke about his opinions of the COVID, and they said that his opinions are totally incorrect. Everything said against the World Health Organization in the letter of Trump are totally counterproductive against what the World Health Organization is trying to do. To put more in context, I propose that you research a little bit more about this letter of Donald Trump. El Comercio on May 16 said Trump threatens to cut permanently the U.S. financing to the World Health Organization in 30 days. Trump sent a tweet of a letter that he sent to the director of the World Health Organization, and he says, what are examples of all of the faults of the World Health Organization during the pandemic, including ignoring the first reports of the pandemic. It is clear that the first steps that they did were extremely bad for the humanity. The only way to go on is if we can show there is independency from China. This is what Trump says to the director of the World Health Organization. If the WHO does not compromise to make substantial improvements, I will make that there be a temporary freezement of the funds that the U.S. gives, and it will be permanent, and that we reconsider the membership in this organization. And I would also like to suggest you read an article called Pandemic and the End of Neoliberalism. This is a question posed by Victor Flores Olea and published in La Jornada. Taking some of the best paragraphs, it says, according to this article, Atilio Orón, the Argentinian thinker, says that he is against what the World Health Organization thinks, saying that there will be a total knockout. And going back to the thesis of Lenin, that capitalism will not fall if there are not social powers that make it fall. These revolutionary forces seem not to exist, nor in Europe, nor in the United States, nor in Latin America. Zizek insists on his thesis that maybe there will appear after the pandemic many forms. This is an intermediate phase where we might be getting away from the barbarism of capitalism and going to better ways of going together. On the other hand, Noam Chomsky, he's an American philosopher, has gone against Donald Trump, saying that his measures have been awful. Many of the health systems are in competence with the private systems. And obviously the private systems are much better. However, all of them are now collapsed because nobody has any type of practice or experience with this type of pandemic. It was not necessary to invest much more, because this could have been a waste of money, according to Trump. Money over people. That is what the capitalism thinks. This is the most coincidental point of view. And what it says is that in the past, this has been proven true. And not because there's going to be a revolution, but because society will not be able to tolerate this type of attitude that capitalism has showed. It means that capitalism might be reaching an end, but this will not be pushed by the violence of the virus, but by the capacity that the leaders in different countries may show. In other words, the world society is now confronting the threat that there might be a new globalization and a new system that might be called post-capitalism. Here it must be interesting to go first to an anti-capitalism. The market economy has showed that they're totally useless for these pandemics, and that the natural order of things is not following by it. So it's going to be a much more important role now. We need a new social contract. Let's expect that the pandemic reinforces the social conscience that is existing, which will constitute a great force for the transformation. We have to do everything possible to stop this virus, knowing all of the deficiency of our system that has been wrecked by 30 years of neoliberalism. Going over everything that's happened on Monday and Tuesday, Enlace Peraza, our correspondent in China, has more information. Greetings, colleagues. Thank you for the contact. The 73 Assembly of the World Health Organization that was held virtually at the beginning of this week was the last chapter of a saga of confrontations between great powers that based from the pandemic of COVID-19, this chapter in which many countries have decided to subtract, and others have decided to add. From the beginning, it was suspected that there was going to be high tensions between China and the United States, and finally this was so. Washington continued with the attacks against China and also against the organization itself. Hours after this World Assembly of the World Health Organization, President Donald Trump threatened by freezing indefinitely the financing of Washington towards this organization, and even withdrawing the membership from this entity. On the other hand, we have China, that, as we know, has taken up positions of leadership, and they made many announcements. President Xi Jinping demonstrated that China is ready to take a leading role in the midst of all of the world's efforts to stop this pandemic. As we know, President Xi Jinping has announced that China would put at the disposition to humanity the possible vaccines that the country might be able to develop against the COVID-19. He also announced that China will support with financial help for $2 billion for the next years to the most affected countries, and will strengthen through all possible ways cooperation to increase the capacity of the world, and especially in the African continent. Experts say that this posture that has been taken up by China in this Assembly of World Health goes against the position of the United States, but also of other countries and companies that have put in front of the human life everything that has to do with income and financial wealth. However, the position that was assumed by China comes to fill a void that was left by the United States at an international level due to their aggressive policies of the White House, and above all saying that trying to impose their policies. This is all. Let's go back to Caracas. Thank you, Iranzi. Let's mark our first pause in our critical moves, but before, let's not forget that we have the question of the day. Today, as we come to an end of the World Health Organization session, where there were review of all the achievements and challenges ahead with the COVID-19. The world community is looking for solutions. Donald Trump is looking for a culprit. Answer our questions. We'll be right back.
In China,
after doing a good effort, we have changed the virus pandemic route, and we have secured our people from the beginning. We acted with responsibility and transparency. We have given information to the World Health Organization and the community of the world in the most opportune way. We have launched the sequence of the genome as fast as we can, and we have shared all of our experience. We have done everything possible to help the countries who need it. We have taken up many measures to reduce the expansion of the virus in our country. For example, teleworking for a month and a half, 150,000 daily tests, campaign of information. We have offered additional information to 1.4 million doctors, and we have reinforced the doctors with 130,000 experts, including ICU doctors. These measures have allowed to have one of the lowest death rates. Without abandoning our responsibility, we have not abandoned the revolution's mission. More than 130 people that have been organized in 26 brigades now contribute in the fight against this pandemic in 24 countries. To these, we have more than 28,000 doctors that were already in countries all around the world. This act of solidarity is regardless of the genocide act of the United States with the blockade, and they have tried to reduce our action. Mr. President, no country on its own can combat this pandemic. We need a world response based on unity, solidarity, and multilateral support. Cuba is part of the WHO and is willing to share our experiences. Thank you. It is necessary to reiterate the denounce of everything that goes against the Venezuelan people with unilateral actions with which they have taken from our country more than $30 billion. This has generated difficulties to access to supplies. When on January 30th of this year, Tedros Adhanom, the president of the WHO, declared that the pandemic is an emergency of world health, many protocols were activated to try to stop the expansion. With the objective to stop the expansion of COVID-19, the World Health Organization asked for a crisis team to coordinate all of the actions throughout the world, the United Nations system, to help the countries prepare through the strategic plan and response. Many answers were created, and countries were starting to prepare for COVID. Among the things that were suggested, it was the prevention, more than preparing the sanitary conditions of these countries. The World Health Organization alerted from the beginning of this expansion about the need to implement social distancing, isolation of certain cities, and suspending massive activities, because the only way to contain the virus is to identify those who have the virus so we can break the chain. To this, it is necessary to give priority to those patients who are at greater risk of contracting the infection, and also to have special programs for vulnerable groups like older people and people with chronic disease, women during pregnancy, and children. Ever since the expansion of the pandemic, the World Health Organization has fostered the cooperation between countries. This has been harshly criticized by Donald Trump, who announced the suspension of the funds to the WHO after a review to this organism. President Trump has evaded his responsibility for the expansion of the pandemic in his country and now points at China. And they say that the World Health Organization was losing time when they were first told, and that there were no measures since months before. We here begin with our analysis with a master's in public health and psychiatric wards. Hello, thank you for your invitation. We're going to speak about this 73 edition of the World Health Organization that the session was held digitally, precisely because of what's going on with the COVID-19. So throughout these 2 days, many aspects were dealt with. For example, there is one that appears on the tweet account of the WHO, and that says to protect the most vulnerable groups is important to defend and to win the fight against COVID. We can't stop its infection if we don't center on all of the affected, including the vulnerable patients. This tweet says, based on this is priority, if we want to stop the inequalities in the deaths due to COVID-19 in our countries. When we speak of vulnerable sectors, who are we talking about? Well, I think it's very important to bear in mind that health is not just a biomedical aspect, but for decades back, we know that it's a central aspect are the cultural factors. This means that there are social conditionings that affect the health of people. Academic studies suggest that the contribution of the health services contribute to 1/3 to determine the health of a population, and the rest of the factors should have a pivotal role to determine the health of our population, but above all in the distribution. From this is that several decades ago, there are more concepts. This is the equality in health. And not only to access of health, but equality in results. For example, in our country, just recently in Chile, there was a study launched in Lancet that says that among the richest parts of Santiago, the capital city, and the poorest, there is a difference of life expectancy of more than 10 years. So, who develop their life throughout these poor communities have the right to live less years. This is dramatic and it's unacceptable. This is why the guidelines, both political and academic, that have been generated highlight this aspect. So in the midst of the pandemic, it's crucial to have the intervention that would be the most effective to reduce the levels of death and control the situation for the good of our lives, but also that there not be any inequality. So now we have to ask ourselves, why would there be these inequalities? And once again, this explains itself due to several factors. Let's go further to these aspects. Gonzalo, I would like to invite Gonzalo Silva. He's a connoisseur from Chile. He is with us through the telephone. How should we understand, Esteban, what is happening now in Chile? Fundamentally in Santiago, the capital city, where there are confinement measures that were expected far before, but it's now when it's recently happening. Well, it's very hard to understand when the infection is growing, and we see how the sanitary authorities have detected many more infected, and 32 are dead in the last 24 hours. So therefore, the growth has been sustained and it has kept on expanding. So basically for two reasons. One, because the necessary measures of social isolation were not taken. And there was no social support for this to happen. This is for the metropole of the city, and this was supposed to happen way before. This would be like the second half of March. And we see how government of Mr. Piñera, there was a social outburst, and it privileged, from this point of view, measures of public order, and there were no drastic measures and solid measures in respect to the coronavirus, and the respect speaks for themselves. And let's not forget that there was a contradiction originally, because they said of first they said that we were going back to normality just a couple of weeks ago. Even the Minister of Health of Piñera said that it's a mistake that classes, the school classes and university classes had been suspended. So this just shows that we are now, this is why we are now confronted with this problem of exponential infection going through Chile. And this is a product of the incapacity of the authorities to listen to the health organization, to the health workers, and to the medical groups. And what they wanted to do is they wanted to go back as fast as they could to normality, which was not possible. And that's why they took isolated measures, and many of them were erroneous, that has now caused this. And there's another element that as time goes by and the numbers are there, so the numbers are becoming more evident, and we think that the numbers at the beginning were just were covered up by the authority. In the second half of March and the 1st of April, and there are many serious investigations that there were no reports because of coronavirus. Well, this was not true. However, the death certificate said that it was due to a respiratory problem, but they were not reported as COVID. And this is obviously, this affects the numbers, and there were probably much more dead people that now, unfortunately, make that the curve is growing. And what we see is that there is almost a total collapse of the public system of health to attend this emergency. Well, it's incredible how parallel is the posture of the Chilean authorities and what has been done from the end of last year in terms of coronavirus by the U.S. authorities. Dr. Gonzalo, I would like to go back to you and ask you about necessary measures to reduce the breach of inequality in societies such as the Chilean. This is so. Well, it's very important to understand why there might be inequalities in the death numbers. So the evidence shows that among the factors that predict major mortality is it age, but also the other deaths, obesity, diabetes, hypertension. Well, it so happens that from some years ago, it is shown that poverty is one of the main elements of risk for mortality, and to have these type of conditions. So it has been observed that the conditions that predispose to these illness are more present, while more oppressed is the social condition of this person, and it's more favorable for those who are on the high level of society. So in that sense, obesity is much higher among the most vulnerable groups. We can't explain, but I guess it has to go with healthy food. So there is more obesity in those sectors. So it is necessary to be at a good health point to support ventilation. And if you are obese, it's going to be worse. Where there is more poverty and there is more people are living in crowded spaces, so it's harder to go through with the recommendations for social isolation. In a context where there is not enough spaces for sanitary actions, In fact, there are several testimonies of people who used to work as gardeners in our city, and then they had to go in the high end of the cities, and then they had to go back to the poor parts. And what happened is that all of his family was infected. So all of these measures need an answer based on public policies. What type? For example, we know that COVID-19 has a huge impact on economy, particularly on employment. We know that in the most impoverished level, these people just earn just enough to survive. Let's not forget that there was even protest in amidst of the COVID. And the people in La Comuna El Bosque took to the streets because they were hungry. We have not seen for this in decades in our country. So we're in a critical standpoint of sustainment of life. And therefore, one of the things that is necessary is an emergency policy. Our country has proposed a minimum wage for families, but when you see the numbers, they're not above the line of poverty. So it's obvious that this type of policies are not enough. So people can go through with the recommendations, stay at home, but at the same time, survive, have enough to live. Okay, so Dr. Gonzalo, thank you very much. We're going to Esteban, and now based on the legislative point of view, because they also have a great responsibility in counterpart of the executive branch to go through with these policies of which Dr. Gonzalo was speaking about. Esteban, what do you think? Well, of course. The truth is that the role of the legislator is fundamental, and I think that it's relevant. However, the problem in Chile is that we're confronted with an institutional crisis. And in this sense, it has been much more complicated to obligate to overview and generate a possibility that the executive branch go through and implement these measures. I think that in our case, we can see that it's just like in other countries, because we have a crisis of representation and legitimacy, because there are parliaments who don't necessarily represent the new majorities in times of crisis. Thank you, Esteban. And I also want to thank Dr. Gonzalo for your time. See you next time. A big hug to both of you. Let's go to a pause, and we're back. We will continue. But why don't you answer the question of the day? It says, the Assembly of the World Health Organization has come to an end, where there has been a review of all of the challenges and achievements. The WHO is finding solutions, while Donald Trump is finding a culprit. We'll be right back.
A review of the world news that investigates, incites analysis, and induces criticism, because every event has a context.
Pusimos el punto en la I.
Dot in the eye. Saturdays. Only on Telesur.
Hola, ¿qué tal? Sean todos muy bienvenidos a Vidas. Hay lugares donde el arte se unifica con el orgullo de los pueblos. Y esos lugares están llenos de colores, alegría, pasión, tradiciones, arraigo, valor y entrega.
Real Life. Fridays.
only on Telesur.
The scale and magnitude of the pandemic crisis has been confronted in the first line by the World Health Organization. And how have this organism worked with the governments of affected countries? How have they done it in the past? This is what we're going to review. With 75 years of existence, the World Health Organization has confronted numerous challenges and registered many achievements in sanitary measures. The recent one is the COVID pandemic. The fast expansion of the coronavirus demanded from the beginning the World Health Organization and the regional offices work together with several governments, along with making a plan and giving suggestions along with experts over the world. This organization has carried forth the fight against the COVID virus with up-to-date information in this way to combat the myths and erroneous beliefs. They have also put in March a project called Solidarity, which is trying to find the best treatments against this disease. The experience in these pandemics and all of their networking has allowed to put in place protocols, and it has been very effective for the pandemics of other in Haiti and Africa. They have allowed to find vaccines against things like blue pox, polio, Ebola, AH1N1. The mobilization of doctor brigades like the one of Cuba has also been supervised and overviewed by the WHO with the special work of tropical diseases. In 1975, the institution supported the display of laboratories that specialized for fast vaccines. This is a second point of analysis. We are working with Gonzalo Basile. He is a professor of Flaxo in Dominican Republic. I would like to reflect with you, given the benefit of the doubt to President Donald Trump. Do you think it's true that the World Health Organization has presented more shadows than light up till now? Well, obviously, this has nothing to do with this, with what Trump is saying, but what is known as a World Health Organization authority in terms of understanding how it works. I think we have to have a comprehensive understanding. On one hand, within this conglomerate that has a World Assembly, this is a conglomerate that today the autonomy and sovereignty over health of the people is not decided by the societies, but there is a determining decision inside. But there is some weight on the private corporations that now have a big weight, not only on the budget of the World Health Organization, because it is financed greatly by these cooperations, these so-called cooperations. But let's not forget that philanthropy is never free. Certain programs are financed and certain actions are financed, but with everything in mind to maximize the potential business. So I think it's important to observe how this could be an opportunity and how the World Health Organization could have, once again, a sovereignty and autonomy to decide on the health of society and not go through with the interests of the corporations or of the. Let's not forget that the WHO has been the main actor that has developed the concept of a world sanitary security, and this has been pushed forward by the U.S. within this organization, and at some point it obligates the South countries to have sanitary conditions that answers a bit more to what the United States thinks of than what the South needs. And there is an ongoing discussion where there is this threat of putting in the idea that the United States will have a vigilance of the world worldwide on the diseases. And this is the World Network of Response to Pandemics, where what they are looking after are all of the diseases that come back. And if there is a vigilance of these diseases, and this is a problem of security for the northern countries. And of course, the medical systems became privatized. And let's not forget that these are also part of the system of the World Bank and the IMF, and they push towards the privatization. And in the case of Latin America and the Caribbean, is the most popular decisions in Latin America and the Caribbean throughout the 90s. So it's necessary to rethink the World Health Organization. And it's necessary to do so with a vision of everybody's needs, not only the North's interest or the private companies' interest. So there's a lot more to be thought of. For example, let's not forget what happened with the crisis of Ebola. To continue in this line of thought, Gonzalo, we just have 2 more minutes, but I would like to take advantage with you. How to imagine a World Health Organization without United States? Since if we hear these reiterated threats, this could become true. Well, in fact, we could be in the process of the pandemic, and there is this possibility, and there might be a situation where there can be new scenarios and how to rethink rethinking certain aspects. Like, for example, if the vaccine should be a public good and not private, and not to be a competition between who presents it, who is able to come up with the vaccine. So I think that there is also a game in this sense, that there is a bet where from the South we have to make an effort to try have some incidents. Thank you very much, Gonzalo, for your reflection for Telesur. See you soon. Let's go to our conclusions. The recently ended session of the World Health Organization had the presence of most of the countries that were affected by this pandemic, and they were imposing certain measures to help in each country. And now we see how important it is to have an international point of view. Those who think that this is not more than a simple cold and they reject the quarantine, although the reality in their own life demands it. And those who have a posture, the intermediate posture, who respect the disease, but open the action of the social activity. Who's right? Well, it's enough to see the numbers. Numbers who not only show what happens now, but what's going to happen tomorrow. This is what we should think of financing of the World Health Organization because of the sovereignty of this organization for their own health. This is all for today. Thank you very much.